Hey there, Jason Denniston here, and it is another Medicare Monday where I take one event from the past week out of my insurance agency and break it down for you. It's something that I think you might be interested in or might help you out. And today I think we have a really good one, especially for any of you who are on a Medicare Advantage plan. And I know a lot of people have Medicare Advantage plans. They're super popular today. And you may have received this document, a different document that you maybe have not received before, and we're gonna break it down. It's called the Medicare Summary Notice. Okay, so I'm gonna pop this up on the screen for you so you can see. We'll edit it in, but there's some things that I want you to look at and notice from this document, because if you're on original Medicare, so people who have original Medicare generally have a supplement like a Plan F or a Plan G, maybe an N, and they're used to getting these documents. So the Medicare Summary Notice is Medicare's equivalent to an explanation of benefits. And so an EOB, or an explanation of benefits, is what you get if you're on a traditional health insurance plan. And it explains the charges that you've been charged by a provider, how much your insurance is going to pay, what the reduced amount, the negotiated rate is, and potentially what you may be responsible for. So a few things that I want you to take note of if this is your first time getting one. And maybe I should back up and say, why would somebody who is on a Medicare Advantage plan be getting one of these documents now when generally they don't? Well, you see, any of the COVID-19 coronavirus vaccines, those are paid for by original Medicare and not your Medicare Advantage plan. Generally, when you join a Medicare Advantage plan, all of your services that are covered by Medicare, they're covered through your Medicare Advantage plan. They're your primary insurer, and so you may be getting explanation of benefits from them. But if you've received the COVID-19 vaccine, you more than likely received one of these Medicare Summary Notices, and you may say, hey, why did I get it? That's what happened in this instance. One of my clients, actually a husband and wife, they both got one of these Medicare Summary Notices, and they said, why am I getting this summary notice? And the reason for that is because original Medicare is actually covering the cost for these COVID vaccines. But I thought this was a great opportunity for me to explain to you, if you do have original Medicare and you wonder, how do I understand these documents? Or if you're on a Medicare Advantage plan and you've got one for the first time and you're just kind of curious, you want to know what's going on, the first thing that you need to notice about this plan is it says, this is not a bill. You will be billed directly from your provider after Medicare has settled the claims for what you are responsible for. So, this will give you an idea of what to look out for, but, know that you're going to get a bill from them. Okay. Now, if you'll notice here, it has your name, your address, your Medicare number, and then you want to look on the left-hand side, the date of this notice and the dates of which the claims have been processed. And so the claims are processed between this date and that date, and it's going to have all of the claims between those two dates. So if you've had nothing, you may not get one. If you had a lot of claims, you may have several pages long for this document. Below that, it's going to have your deductible status. For people who are on original Medicare, they will have a Part B deductible that they have to meet, whether their supplement picks it up or not, and so it can tell whether that's been met. Now on the right-hand side, you can see these are some very important things to notice. Your claims and costs this period. Did Medicare approve all of the services? If it says yes, then all the claims that your providers have submitted for you have been approved. Now, I've seen these before where there are claims that have not been approved, but we'll talk about that in just a minute. Now, the next thing that you want to look at is the total you may be billed for, okay? And in this instance, it's 0 because the COVID vaccine is covered at 100% by Medicare. So there's no cost. And so when I was meeting with my client, and I said, hey, just don't worry about this. It's just a notice, and there's nothing you have to do for it. You should not be billed. If you do get a bill, you're going to want to take a look at that because, as we see on the next page, your provider has been paid in full all they're allowed to charge you for the services. Okay, so let's look at the next page. Okay, So you'll see at the top it says claims for Part B, medical insurance, and it has the definitions of the columns. Medicare, I think, does a pretty good job of explaining, whether it's their Medicare and You handbook or their documents. They do a good job of trying to help you understand, but there's a lot to go through, but they do explain it very well. So you can see the different columns. So the first column is service provided and billing code. Okay, so this is where you see what exactly your provider billed, okay? And you notice that at the end it has these codes, okay? And so when we talk about medical billing coding, these are the codes that the doctor's office or the hospital that they submit to your insurance, whether it's Medicare or private insurance company. They submit these codes, and depending on the code determines how much they're allowed to charge and how much your insurance will pay, or even if your insurance pays at all. So if they submit the wrong code, then Medicare may deny the claim. They may not pay as much on it. They may not pay at all. And so if you have trouble and you had something done that you think should have been covered, well, maybe you need to check and make sure that the doctor's office, because this happens, okay? There's a lot of intricate codes, a lot of different ones, and the people at the provider's office may have submitted the wrong codes. Call them up, ask them, say, hey, is this the right code for this procedure that I had done? Why is it not being covered? I assume that it would be covered by my Medicare or my insurance, okay? So that's the first column. The second column is service approved. And so that's just basically saying, did Medicare approve or deny it? It's going to say yes or no. If it says yes, Medicare approved it. If it says no, then we need to dig in further and see why they didn't approve the code. In the next column, you see the amount provider charge. So that's actually how much they billed. And we see providers bill a wide range of prices for the same services. But in the next column, which would be the fourth column on here, you can see the Medicare approved amount. Just because a provider charges a certain amount doesn't mean that Medicare will approve or allow them to charge you that much. So you can see in the fourth column is the Medicare approved amount. In this situation, so in this example, the provider billed $16.94 for this first service. Medicare approved $15.83. Since Medicare covers 100% of this, they paid the $15.83, and that's the full amount that Medicare has approved. And then the next column, you see the maximum you may be billed. They are not allowed to bill you any more than that. So that's zero more that you may be billed. And then a really important column is that last column. It says the notes. So see the notes below. We have an A and a B on the first service and a B on the second service. So let's see what those notes are. So A, the approved amount is based on a special payment method. That's something to do with how Medicare calculates payments for these services. And we know that things tend to be different a little bit now because of COVID. And then Part B, you can see this service was paid at the 100% of the Medicare approved amount. Now, most providers do accept the Medicare approved amount. In very rare instances, do they not accept that Medicare approved amount, but it's very few and far between. Now, that can happen, especially if you're on original Medicare. Now, if you are on a Medicare Advantage plan, it works a little bit different, and you have networks and providers and things that you need to work within. But this primarily is for people who are on original Medicare, this document, the Medicare Summary Notice. And in this situation, sometimes Medicare will still pay, original Medicare pays for certain services. We know for these COVID-19 vaccines. So I hope this helps you understand the Medicare Summary Notice, especially if you're on original Medicare or original Medicare with a supplement. And if you're on a Medicare Advantage plan and you've gotten that COVID-19 vaccine and you've gotten one of these notices, you're wondering what it's all about, well, you can know that you really don't have to worry about it too much. You can look at it, it's interesting, but your COVID-19 shot should be covered at 100%. You should not have anything to worry about as far as paying a bill. You can see that all in the notice. If you have any questions, I'd love to talk with you. If you have questions about your Medicare, your Medicare plan, feel free to hit me up. My contact information is listed. So I hope you're having a great day. We'll talk to you soon. Bye.